Okay, let's unpack this. If you've ever dealt with thinning hair or know someone who has, then today's deep dive is definitely for you. We're talking about androgenetic alopecia, male or female pattern hair loss.
Right.
It affects, what, up to 50% of us?
Yeah.
And it can have a huge psychological impact.
Oh, absolutely. It really can.
So our sources today look really closely at finasteride. It's a very common treatment.
It is.
And our mission really is to cut through some of the noise and just understand the science.
Exactly. We want to explore how it actually works, like at a basic level. And also what you can realistically expect, if you're thinking about treatment. And of course, the safety side.
The whole picture.
The whole picture. We want you to walk away with a real understanding, not just surface level facts.
Yeah. Okay. So as we were digging into this, one thing that struck me was it's not just about testosterone, is it? There's something more specific going on.
That's right. The main culprit, as our sources really detail, is dihydrotestosterone, DHT.
DHT.
Okay. And what's fascinating is how it's made. There's this enzyme, 5-alpha reductase, specifically type 2.
Type 2.
And it's highly concentrated right there in your scalp hair follicles. It basically converts regular testosterone into this much more potent DHT. And that process, that's the hormonal trigger for follicular miniaturization.
Which is when the hairs get thinner and shorter.
Exactly. Thick, healthy hairs are gradually replaced by these finer, shorter ones. It does raise a kind of interesting question, though.
Which is?
Why does the same hormone system grow body hair but shrink scalp hair? At least in people who are genetically susceptible.
Good point.
It really comes down to the local programming, how that specific follicle is set up to respond.
So the body's own system kind of turns on itself, in a way, for scalp hair.
You could put it like that, yeah.
And finasteride is described as this precise interrupter. How does it actually stop that conversion? What's happening chemically?
So finasteride is what we call a selective inhibitor. It specifically targets that type 2 5-alpha reductase enzyme we mentioned.
Right, the enzyme making the DHT.
Exactly.
Yeah.
By blocking that enzyme, it just prevents testosterone from turning into DHT in the scalp.
Okay.
And the clinical studies show this works. Fast scalp DHT levels can drop like 60-70% pretty quickly.
Wow, that's a big drop.
It is. And when you remove that DHT signal, that inhibitory signal, the hair follicle's natural growth cycle can start to sort of normalize.
Meaning it stays in the growth phase longer?
Yeah, it extends the anagen or the active growth phase, and that potentially reverses some of that miniaturization.
Okay.
And digging even deeper, molecularly speaking, our sources show finasteride actually disinhibits or frees up something called the wnt-catenin pathway.
Wnt-catenin? Sounds technical.
It is a bit, but think of it like a fundamental growth switch for the hair follicle. DHT was basically holding it back, and finasteride lets it switch back on.
Okay, that makes sense. Incredible mechanism. But for you listening, the practical side is key. What's the timeline? Does this happen fast?
No, it's definitely a longer game. While the DHT levels drop really quickly, like within 24 hours,
right.
Seeing visible results takes time. That's just the nature of the hair growth cycle. It's slow.
So patience is needed.
Absolutely. Don't expect visible changes for maybe 1 to 3 months. Some people even notice some initial shedding first, which can be a bit alarming.
Oh, okay. Good to know.
But the real improvements, stabilizing the hair loss, maybe seeing some regrowth that usually becomes apparent around the 6 to 12 month mark.
6 to 12 months, okay.
And there are long-term studies, too, like a big 10-year Japanese study showed remarkable durability. 99.1% of men prevented further hair loss progression.
99.1% over 10 years. That's pretty impressive.
It's a huge number. It really highlights that finasteride's main job is often stabilizing the loss. Regrowth is common, but it's often a secondary benefit,
Right, managing expectations. Stop a loss first. Okay, but no deep dive is complete without looking at the risks, the potential downsides.
True. We have to talk about side effects.
Also, any new developments. What did the sources say there?
Okay, so the most talked about side effects are sexual, things like decreased libido, maybe erectile dysfunction.
Mm-hmm.
The trial data usually shows this affects a small percentage, maybe like 1.8% for lower libido versus 1.3% in the placebo group. So it's relatively low and often resolves if the drug is stopped.
Okay, relatively low, but still something people worry about.
Definitely. And importantly, there are also reports of psychiatric effects like depression and something called post-finasteride syndrome or PFS.
PFS, I've heard of that. That's where symptoms continue after stopping.
Exactly. Our sources indicate it's a complex issue where symptoms can persist. It definitely means careful discussion with a doctor is essential.
Crucial.
And critically, finasteride should absolutely not be used or even handled by pregnant women. It's teratogenic. It can cause birth defects.
Very important point. So those low percentages for sexual side effects are one thing, but PFS does sound like a serious consideration.
It is.
Which maybe brings us to newer approaches, like topical finasteride.
Yes, that's a really significant innovation discussed in the research.
What's the advantage there? Just avoiding swallowing a pill?
It's more than that. The idea is to maximize the effect right where you need it on the scalp.
Makes sense.
While dramatically minimizing how much gets absorbed into the rest of your body, your system.
Less systemic exposure.
Precisely. Studies are showing it can achieve, similar improvements in hair count compared to the oral pill.
Really?
Yeah, but with much lower reduction in DHT levels in the blood, maybe around 25-45% reduction systemically compared to the much higher drop with the pill.
So potentially much lower risk of those systemic side effects we just talked about.
That's the potential benefit, yes. It offers a way to target the problem locally while lowering the risk profile.
Fascinating. Okay, so this deep dive really highlights how precisely finasteride works, targeting that root cause based on, well, pretty specific molecular science.
It really does.
As you listening consider all this, what's maybe one final provocative thought for you to take away?
Well, maybe think about this. How a drug initially developed for something completely different prostate issues actually ended up revolutionizing how we manage hair loss through this very specific molecular targeting.
Right.
And now how that evolution continues with things like topical delivery, constantly refining the approach, hitting the target more accurately maybe with less collateral impact. It's quite a journey in targeted therapy.